How do genetic diseases affect marriages, relationships, and family life? The birth of a child with a genetic disorder changes far more than a family's medical history. It transforms relationships, emotions, hopes, and the course of everyday life. For many families, the diagnosis comes unexpectedly. With little understanding of genetics, questions soon give way to accusations. A mother may be blamed for giving birth to an affected child. A father may be held responsible because similar illnesses existed in his family. Love, once rooted in trust, can gradually become overshadowed by doubt and guilt. Yet science tells a different story. Many inherited disorders are caused by recessive genes carried silently through generations. Healthy individuals may unknowingly carry the same altered gene. And when two carriers have a child, the condition may appear, not because of anyone's fault, but because of the way genes are inherited. Ignorance, however, often speaks louder than knowledge. Misunderstanding breeds conflict. Couples who should support one another instead find themselves burdened by blame. Emotional distance grows where compassion is needed most. In some societies, the tragedy deepens. Families, driven by tradition rather than science, may pressure a husband to marry again in the hope of producing a healthy heir. Wives may endure humiliation for a condition they did not cause, while husbands carry silent guilt for circumstances beyond their control. Such decisions rarely solve the problem, for changing a spouse cannot change the laws of genetics. Beyond emotional suffering lies another reality. Lifelong medical care, repeated hospital visits, rehabilitation, and financial hardship place enormous strain on families. Parents sacrifice careers, siblings often receive less attention, and every member of the household carries a burden that cannot always be seen. The greatest loss is often not financial, but emotional. Dreams are reshaped, fears become constant companions, and uncertainties shadows every future pregnancy. Fortunately, knowledge offers hope. Genetic counseling helps families understand the true cause of inherited diseases, their pattern of inheritance, and the options available for future family planning. Genetic testing empowers couples with information before marriage or pregnancy, replacing fear with understanding and blame with compassion. The purpose of genetic testing is not to divide families, but to strengthen them through informed choices. Every child deserves love, dignity, and acceptance. Every mother deserves compassion instead of accusation. Every father deserves understanding instead of guilt. And every family deserves the truth that science provides. Genetic diseases do not merely affect our genes. They shape our relationships, our resilience, and our humanity. Yet, through education, awareness, and timely genetic counseling, families can move beyond fear, preserve their bonds, and build a healthier future for generations to come.